So you say also, so now we've satisfied the real estate crisis, very simply I might add. So now you've said you've also have some solutions to the healthcare crisis, which is an issue that's been just going on through one presidency to the next. And now they have some new so-called solution. Can you tell us about your solution and how it compares with what's been done so far by President Obama and his crew?
Well, what's interesting about both the Democrats and the Republicans is that in both cases they admit that the best of their proposals only will take care of a small segment of the costs, and that number two, it is a stopgap measure. So from the opening premise, they're saying this really isn't the answer. This is to buy us time until we figure one out.
Band-Aid.
It's a Band-Aid. And so on the Republican side, for example, they're saying, well, we shouldn't have these, we shouldn't have these, we need to put a cap on lawsuits. And as Obama had pointed out to them, that represents just 3% of the cost. And as somebody says, well, that's not just 3% of the cost, there's a greater impact of that. And I had pointed out to them that that 3% is actually the cost. The impact is slowing down the process but not really adding more cost. So therefore, even if you took care of that, and if you added up the majority of the Republican proposals, it doesn't really take care of more than 5, maybe 10%. Same thing with the Democrats. What the shame of that is that just, I believe it was this year or last year, there was a jump in insurance premiums by like 20%. It was either 15 or 20%, very significant. So in other words, all the savings that they're after can be wiped out in a single year. What got me started was from my own training and exposure from my years going to school in India. I studied Eastern philosophy there. And their system of medicine starts with the premise that 50% of your health is lifestyle. 50%. And so when I heard that coming up almost as a mantra in the debates, and actually over the years, that 50% of the medical cost in this country is lifestyle, I was like, well, if that is 50%, why don't we take a look at lifestyle? And so we started off with, a half a dozen different areas of lifestyle. And in those examples that we saw, it was almost obvious how we could actually reduce costs by not only 50%, but dramatically improve services.
So, and how is that?
Well, one of the examples we saw was in the case of alcohol. So with alcohol, the social cost is $200 billion a year. And, at $200 billion a year, it sounds like a lot of money. But what we saw is that out of that $200 billion, $100 billion, it was about $85 billion or so, almost $100 billion was caused by just 4% of those consumers. And those consumers obviously are the alcoholics. And so what we realized is that if we spent $5 or $10 billion taking care of the alcoholics, we would save $100 billion on the back end. So it's the policy of penny wise and, an ounce of prevention is worth a pound of cure. Out of the remaining $100 billion, $60 billion is drunk driving. All the other consumers combined is responsible for just 20% of the cost. So as soon as we opened up that paradigm, it just changed the entire context of the discussion and the debate. The premise that we've been, well, we'll get into that in a minute. So that's one example of out of the half dozen or so that we looked at.
So let's just follow along on that particular lifestyle. It's alcohol as a lifestyle. And because it'll probably ring true through all the different lifestyles that you took a look at. But let's just to concentrate on that one, and so that we can try to understand better your principles. So you have 60%, you say, of the costs of the health care related to alcohol is owned by the alcoholics, those that drink more than a certain amount every day or every week or something. I don't know what the statistic is, but so how do you make up now for that? How do you remedy that cost going out by the government to cover that?
Well, here's what we found that was very interesting.
Or by the people. We think government's paying, but the people are for, it's
through taxes and things like that. Well, what we found was that in the case of, we looked also at the example of tobacco. And what we found is that quite often the social cost for these things was actually being paid by the consumer at the point of retail, at the retail purchase. So the taxes on tobacco, for example, in fact covers the social cost of smoking. To just clarify for those that may not be familiar with the term social cost would include all the associated expenses with a particular thing. So in the case of alcohol, the social cost would be drunk driving, spousal abuse, extra courts, hospitals, and jails to house the alcoholics that have engaged in crime.
But if we're talking about Medicare, medical, healthcare, the healthcare crisis, and we're trying to stick to the healthcare costs from a particular social lifestyle. So how does it, let's stick on that and just kind of, give us one of these simple explanations to how we understand your principle.
So what we're suggesting is that the taxes collected from tobacco, collected from alcohol, goes exclusively to deal with the social cost of those issues. And so what we're saying is that the cost may be very high, but if the cost is broken down to each purchase, then all you're talking about is an extra 1 or 2 or 3, or in the case of tobacco, $4 per pack of cigarettes, which is what they're already paying. And so by putting that price at the time of purchase, it's an affordable pay-as-you-go. It's, in fact, the most affordable insurance policy that you could have.
So what you're saying is, now I think in like New York City, for example, I think you pay $5 or $6 or I don't know what. Is it even more than that?
New York is an exaggeration of the point. I saw them selling a pack of cigarettes for $9.25 for a single pack of cigarettes. On average, nationally, it's about $4.50 or so. Here in Honolulu, it's getting up to $6 and $7 as well.
So you say on average it's maybe $5 a pack for cigarettes now. So what would be so what you're saying, it seems to me, is that the people who want to engage in these kind of social activities, they will bear the brunt of the health care bill that comes as a result of those activities. Is that?
It initially started off with that. When I was a younger man, I was something of a preacher, and I originally looked at this from the perspective of vices. So when Clinton went after tobacco, it came out that we're spending $100 billion a year on smoke, and I thought, well, what a terrible thing. What would be the social cost of all the other vices? Smoking, drinking, gambling, prostitution, etc. And what we found is that it comes out to about $1 trillion a year. And so as a preacher, I felt empowered that I had something to sort of hit people over the head with, starting with smokers. Back in those days, pre-Clinton's attack on tobacco, a pack of cigarettes was going for like $1.75. And at that time, I knew that the social cost was about an extra $4 or $5. And of course, they all came out and said tobacco will never allow you to charge them the social cost. Here we are today. Not only are they paying the social cost, but they're paying more than the social cost. And so if they were to go with our system, in fact, smokers would be getting charged less under our system. So originally it started off as something of a preacher's, zealous attack on vices and smokers, simply to discover that in our system, they would in fact find remedy from the gouging that they're now suffering at the hands of government.
So let's say the tax on cigarettes is $3 a pack or something. So how does it work then? How do you save money through this kind of a healthcare system?